Quick disclaimer before we begin, the PEMF podcast does not contain any medical advice, and the content provided is for informational purposes only. If you have any health concerns, please visit a healthcare professional. Welcome back to another episode of the PEMF podcast, and today we're joined by a very special guest all the way from Canada, and that's Professor Joseph Toy, who some of you may have seen on Instagram with Justin and Gnarly Augustin. But for anyone who hasn't, Professor Toy, can you introduce yourself? Can you tell us a little bit also about what you do now and a bit about your background in medicine?
Okay, now what I'm doing now, we do own three clinics, three specialized PEMF clinics, one in Ottawa, the other one is two of them are in Montreal, Blainville and Dollard-des-Ormeaux, which is in the West Island. So this is basically what I'm doing. I'm a PEMF medical protocol specialist. I'm a graduate from med school in psychiatry, but I'm not a physician. I'm no MD. I didn't pay for the license. I'm not there. I'm just doing PEMF, and that's my main focus. It's a PEMF. Mm-hmm. But prior to that, as you were mentioning, we were talking before, I was a Kung Fu master. So some people are, sometimes they think it's my twin brother, but it's actually me, because I made a whole career as a Sifu, as a Kung Fu master. I became like the world ambassador in Hong Kong Kung Fu and gold medal and at the Olympic Master Championship in 2008 and so long. So I had a very good career in Hollywood and creating the fight scenes for the movies. And then I switched back to the medical kind of a background I had, because first at the university, I studied chemical engineering, biochemical engineering, to be able to become like a specialist in medicine for food, processed food, And then I had to stop and start teaching Kung Fu at I started teaching Kung Fu at university, and I became so popular. So I said, okay, I guess that's my destiny. So I just went on to open 26 studios all over the world and teaching all around the world. And this is what I did for 35 years, something, while going back to university. Because life is very strange at some point. It brings you back to what you're supposed to do. I guess the universe has a story for you, and you can't go way too far.
Coming from Kung Fu backgrounds back into medicine and into the world of PEMF. So
yeah,
it's pretty
that's
interesting.
From the National Defense Department in Canada and the Veterans Affairs. They were looking for a way to take care of PTSD. And I've been asked to find a solution for that reason, for that purpose. And I went to travel and meet with different high-ranked officers of different army corps, part of the NATO organization, and found out about PEMF. So I went deeper into that research and what they were doing. In the States, they were doing some very interesting stuff. In France, they were doing some very interesting stuff. In Switzerland as well. So I went back to study and specialize myself in PEMF. I have to, because it's part of a research program for the Veterans Affairs. So you need to stay on track with the real science behind it. And then I went back to med school to finish the diploma, because I didn't finish like 30 years before. So I went back finishing to add some credibility to the whole process. And here we are 23 years later, still doing PEMF.
Yeah, and quite interestingly, you were given a Diamond Jubilee Medal by the Queen Elizababeth as well. Was that to do with the PTSD and your treatment and with PEMF? Yeah,
yeah, exactly. This is an honor that has been given to me from the Queen because of the results we had using the protocols I created for PTSD for the Veterans Affairs and the military. So success rate was so high that actually when we gave the report, I've been asked to lower the success rate because nobody's going to believe it. So we put 93% success rate, but actually it was more over 97%. So, and some locations we had 100% success rate. So the protocols I've created for PTSD using PEMF were very successful.
Yeah, no, it's amazing. I mean, we're all trying to raise the profile of PEMF and talk more about it and give the benefits of PEMF therapy. And there's no better way than getting recognition from the Queen from that. So, thank you for that. And it's such amazing work.
No, it's such a blessing, because actually sometimes you work behind the camera and nobody knows it, and you're going to be ending up like having success or being happy with what you do, which I'm very happy with. But having the Queen recognizing what you're doing, it's like, whoa, okay, I never thought about that. So, okay, I'll take it.
Yeah. So where did it all start for you then? When was the first time you actually stumbled across PEMF, and where did that start?
First time I came across PEMF was at university. A teacher at med school at Laval University in Quebec was a big believer in PEMF. And she was like teaching on the side what PEMF could do. And of course, we had 2 classes only, so it's not that much. But the thing is, it's still those same 2 classes 30 years later at med school. But still, they do have 2 classes on PEMF. So I thought that was interesting. But you know what? Just kept over there. And what brought me back to the whole thing was actually the National Defense Department, DND in Canada, who, when we start doing the research, which was called Doors of Hopes, for the PTSD suffering military, I came back to PEMF, but in a different way, because they were calling it at the time neurostimulation. So I thought it was different. And then I discovered that there is so many different names used for PEMF that actually are the same. If you do electrotherapy, magnetotherapy, neurostimulation, neuromodulation, it's all the same. It's basically PEMF. It's pulse electromagnetic field applied differently, but depending on the medical department using it, they are going to use different names. Me, I did start my career in my own wellness studio or wellness clinic, using neurostimulation, because the private insurance company at the time were using neurostimulation, and still today some of them are using neurostimulation. That's for the purpose of the insurance. But PEMF, it's the branding you can find on the internet if you search for it. If you're going to the U.S. Library of Medicine and you Google like neurostimulation, you won't find much research. But if you do put PEMF, then wow, that's a big door opener for the research.
So when you first discovered PEMF, you start getting some results with it. So were you an onlooker to start with, or did you start applying it to people? And what were your initial results coming back from it?
They were not as great as they are today, because we first started, we didn't know at the time what could be done with PEMF exactly. So basically, I was using only 2 frequencies. The ones that Dr. Robert from Laval University was telling me, they were like, oh, so extraordinary. So I was using them. We were having results, but sometimes it took so long. And when I started doing my own research, developing the protocols for the PTSD program, I went on reading over, let's say thousands of research out there. Some of them were not working. They were saying, oh, PEMF is not working for this and that. And, oh, wow, PEMF is working for this. So I read both of them, the ones that were good and the ones that were not good, trying to understand why they were not good and why they were good. And then I start realizing that frequencies was a very important part of it, and most people were not aware of that. It's not like an on-off button you push and here you go. You You buy a bike and then you're going to be Tour de France champion for right away. It takes more than that. So obviously I push myself, and then I start creating protocols. Okay, this frequency seems to be working. This frequency seems to not be working for that same purpose, but it does work for a different purpose. So then I start to map out the cellular systems language. So that's basically what I did for the last 2 decades, to map the body's language from the cellular system, because this is what we're doing. We're speaking to different cellular systems of the body and coming into supporting the homeostasis of the body.
Yeah. Okay. So let's drill into your PTSD side of things again. So what is your average PTSD person, or what do they look like, and what are they coming in for? What are they looking for from you?
What they look like is very funny, because they look like normal people, because PTSD, you cannot see it. And it's a very, very, how can I say that? In French, we say hypocrite. I don't know if in English, I cannot find a way. It's like a double face disease that it looks like you're okay, but you're not okay. And at some point, you get so used to it that it becomes your identity and becomes your personality, and you think it is. Even me doing martial arts, I was PTSD myself. And you know how I discovered the whole thing? By taking care of our military. I was so understanding them. At some points, one of them, a very good friend, Dan Drapeau, who was the advocate for Veterans Affairs at the time, was telling me, "Are you sure you're not PTSD yourself? You do understand us like so perfectly. It seems like awkward." And I say, you know what? It might be. And then I start using my own protocols, and then the people around me start telling me, "Wow, you're back like you were before. You're so gentle and this and that." Wow, okay. And I realized it's exactly the same that happened actually to the military. The wives were calling me, "You brought back my husband." They were crying on the phone. I was crying with them. I was so happy for them. And I was like, "Oh, you brought back my husband. When you left, he was one man. And when he came back, it was totally different." So that's how I realized that PTSD is very like it's very hypocrite. I'm sorry, I can't find a word in English, but the thing is that you're not aware of it.
So it's like an invisible illness. And I mean, we say in England, a lot of disability is invisible. It's not invisible. It's not visible to everybody else. So what outcome is the best outcome? Are you trying to calm the mind down and bring the person's personality back? Is this like the goal, the outcome of your sessions?
It's bringing back the person to their real them, the real you. It's coming back to your real you. Yeah. And sometimes PTSD, we're talking about military, but PTSD is everywhere. It's not only military. Of course, they are suffering from it. There is no doubt about that. But we can have PTSD from living like a tough life, or not even like tough lives. They're just saying one very tough event can hit you very hard. And PEMF is working its way at the cellular levels and the exchange of hormones in the brain. And research has shown that the one thing that PEMF is doing actually is to rebuild the synapse of the brain, because that's the possibility that PEMF gives to the body to boost the energy to regenerate the cells of the body. And NASA has demonstrated in a very profound research that it could regenerate cartilage, but it's not only regenerating cartilage of the body, it's regenerating cells and tissues and many things like in the body. But you need to use the proper frequency to do it. And you need to also personalize the program. That became the second step of what I was doing, to personalizing the program, because everybody's different. Everybody's reaction is different. And sometimes you use the kind of the protocols to the precise protocol for one purpose, and you don't see seems to look like to having like the same reaction as the other client you did before. So then you need to personalize, because his language is different. If we want to speak to Italian sales, for example, we need to speak Italian to make ourselves understandable. But sometimes, even in Italy, you can use a different language, because in some pocket of the city, they do have their own slang. You understand? The sales, I realized that the cells of the body they do the same. Sometimes they do have their own slang, so you need to speak their slang to be more understandable for the cellular system you're targeting.
So you pretty much answered this question, but what is the PEMF doing to the body on a physiological level to help with PTSD? So we're creating a magnetic field around the body, we're pulsing it at different pulse rates, but physiological, what's that doing inside our brain or inside our bodies to help with alleviate the symptoms of PTSD?
Yeah, it's rebuilding the cells' levels of energy. So when a normal cells is supposed to be in between minus 70 to minus 90 microvolt. And when there is like a depolarization of the cells, of course, the body cannot sustain its rhythm, a normal or optimal rhythm of regenerating itself. So when the number of cells is getting bigger and bigger on the depolarized side of it, so then you have like obviously any health issue is going to come out. And it's a paper that has been out there since 2011 by Dr. Mutha from Harvard University, saying that when a cell do have energy crisis, there is a health issue that is going to come. And he was able to say that diabetes, cancer, normal aging, Parkinson, Alzheimer, all comes from the depolarization of the cells. So what the PEMF does to the body, it's repolarizing the cells, or re-energizing the cells of the body.
No, amazing. So sticking with the PTSD, how would you typically apply a PEMF device? So are we talking about full body mat, or are we talking about transcranial, or some? How do you typically apply it?
Typically, with PTSD, I'm always starting with the full body mat to target the central nervous system. But then you can move on to transcranial applicator. But the thing is, depends on each person. Some people for some reason, do react more on the full body than others. And some others, you'll do the transcranial, and it's gonna be a very good reaction. It depends. That's the personalization, and that's one part of the personalization we're talking about. We're talking about the protocols, the right frequency for them, but also the way to apply it.
And typically, someone that's come to you with PTSD, how long until they're starting to see or feel results? So what does that map look like?
Harvard presented a paper on depression and anxiety, and was discovered in research, and within 20 minutes, you can see positive results. So this is exactly what's going on. So positive results are very quickly to happen. How will you see it? It depends. In between 3 hours to 30 hours to see the full results of you coming back to your normal you, which most of the time is the people surrounding you that are going to tell more about that, because you feel that it's so gentle. You feel you can manage. I'm just thinking about one client. He was telling me it was chaotic at his work, and he used to lose his temper, but for some reason now he can stay there and speak with people without losing his temper. And he was asking me, is it a good sign? I said, yeah, of course it is a good sign. But you see how PTSD is working its way like an invisible ghost, and trying to understand how you must be feeling. It's very strange, because you're used to be you, but it's not you.
Yeah. Yeah, so so PTSD is saying quite a quick response time. So we're not trying to rebuild cartilage here. We're not trying to strengthen bones, that sort of thing. Which is really good with PMF, but can take some time. With neurological effects, one of the main things we see with people buying our systems is their sleep. One session and their sleep is improved, and it's one of the main physiological effects we can say to people. Tell us how you feel tomorrow morning, and go from there.
Sleep is, that's a very good point, because actually you're right. And most people will find a very good sleep right after the first session. But some people won't do. Some people will find like an uplift of energy. And one of them, actually, I just remember one of our clinic in Quebec. He was like having so much energy. He passed the whole night doing like the vacuum, cleaning dishes, and doing the whole house, like cleaning in the middle of the night, because he was having so much energy. And sometimes you have like a boost of energy, and sometimes it's the sleeping habit. But most of the time, you're right. They sleep better, and more profoundly. Yeah, instead of 3 hours at a time or 5 hours at a time, they wake up like, wow, I've been there for 7-8 hours.
Yeah. So you've touched on it a couple of times, but have you got any particular case studies where someone has really blown your mind? Where they've come in with quite severe PTSD, and the whole process has gone pretty smoothly, and their life's been changed.
Actually, I had one case at the time, Second World War veterans who came to the clinic with his wife, and I thought they were like so an inspiring couple. And he was telling me his story, what he'd been through, and it was horrible. Even me, by listening to him, I could feel like, wow, my goodness, I will have to vacuum myself at the end of the day. And we did like 1 hour session to start the program. It's based on a 10-hour program, actually, at our facilities. And he started the first hour. And then the very next day, his wife calling me saying, wow, he's a different man. He's a totally different man. She's one of them who told me that you brought back my husband. When he left the war, he was one man. When he came back, he was a different man. But now he's back to what he was. I was like, wow, that's great. That's after 1 hour. And then they told me, okay, we'll see how it goes. And then we'll take the rest if needed. And they never called me in 15 years.
Must be a good sign.
I guess it is a good sign. Yeah, only 1 hour.
Yeah. No, it's incredible. So moving away a little bit from PTSD now, who do people come to you for other problems? So, you use PMF devices of multiple things, but what are those other conditions look like? What are people, and what are you getting success with? It
varies a lot, because actually I've been known around the world for targeting precise protocols for different cellular systems. So mainly it's everything. It's like a fashion. How can I say that? A fashion season. Sometimes you got more degenerative disease. Sometimes you have more chronic disease, and sometimes you have acute disease for some reason. I don't know why, but and also there's like a new aspect to it, preventive situation. There's more and more people coming in to prevent something. I got Alzheimer family, genetic things going on, uncle, dad, mommy, and I don't want to be there. So they start coming in before, which is a very good idea, because most of the health issues that are coming out in the 70s are taking roots in the 50s. So you can actually in the 50s prevent those things by doing PMF as a preventive tool for it.
Yeah, and I love that you're saying that.
It varies a lot, because we got at our facilities, we have like people from different things, because they know we can target different cellular system that brings like different situations to different issues.
Yeah. No, we're seeing the same trend. I mean, I've been involved in the PMF industry for 10 years now. And one of the most common questions we'd always ask people is, what do you need this device for? What are you trying to treat? But we're moving away from that now, because a lot of people we're asking that question to are sort of like looking at us, well, there's nothing wrong with me. I'm buying a PMF device because I want to be super healthy and I want to prevent things from happening in the future. So we can see that shift happening, which is incredible. People are starting to act now rather than act when it's almost too late or at the point in which they're already in crisis. So it's encouraging that you're saying that.
It is. It's the preventive word is getting out there, and people are aware now that it's easier to prevent something than to take care of something.
Yeah. And did your application change at all in terms of if someone's coming for, they've been told they're going to have a knee replacement and they're sort of saying to you, how can you help me prevent this from happening? Does your application change from someone that you're treating with PTSD?
Yeah, because it's a different protocols. It's a different program because it's not the same frequencies that are going to be used for cartilage like regeneration compared to the neurocellular system. It's totally different.
Okay. And you've worked in the past with hospitals to look at MRI scans kind of before and after using PMF and before and after your protocols. What are you looking for typically in an MRI in those instances?
Yeah, I used to work at a cancer clinic in New York before, so it was kind of very impressive to see the MRI or the scans of the tumors at the time shrinking or totally disappearing. So we could have like a visual proof of what was going on. What I did like with that clinic in New York actually was the fact that I was able to use my personalized protocols, and the doctor over there were able to scan, to MRI, and do whatever they were doing for the patient. Even in blood tests, we could see the change. So it's a very important tool for us to be able to show the client, because we call them the client. We're not allowed anymore to call them like other thing than the client. It is in Quebec. I don't know in UK, maybe it's different, but in Quebec, it's the way it is now.
Yeah.
But you could see the difference, and we can show them. And it was even in New York, doctor was doing the scan. He was showing to his patient over there, and they were happy to see, wow, I don't feel much, because PMF, the strange thing with PMF, other than feeling warm, some tingling sometimes, or feeling most of the time relaxed, or even sleeping on the full body mat, you don't feel much.
Yeah,
because it's magnetic field. It's like grabbing a magnet in your hand. You don't feel the magnet. It's a magnet, but you don't feel it. And but you can see the result with the MRI. So even like with that clinic in New York, we did like a real-time PMF scan, and we could see the tumor shrinking in real time. Wow. That was impressive.
Yeah.
And we could see the bloodstream changing in real time. It was like from slow into an active one.
And that's so important. I mean, you may be able to see it if you're watching this podcast, but in the background, I've got a dark field microscope, and that's something I bought. Again, it's difficult, like you say, a lot of PMF therapy is anecdotal because you're asking people how they're feeling, and because it's not like, it's not like a cold bathtub full of ice cold water. You get in that, you feel it, what's happening, and this therapy is completely painless and can happen in the background while you're watching TV almost. So it's great to be able to show people something happening and to actually compare blood results from start to finish, which I think you've done before as well. You've looked at red and white blood cells. What are people looking for there? Where's the difference before and after a PMF session?
Actually, you can see that the immune system is getting stronger. The neural count is getting higher. The red blood cells count is getting higher as well, and oxygenation. And you can see from different organs, if the blood test and they go to the liver, for example, you'll see the GGT changing. Some of them have the GGT very high, and then it's getting lower. And There is so many things that could be targeted, even like a simple blood test, so we can see the difference in between before and after. And I like it when they are followed by, because people need to keep to stay followed by their physicians. It's very important to consult with the doctor, because he's going to do the test. And from there, we can assess the difference, and the doctor can assess the difference. So that's a very good point for them to know if something is going on. And if it's not working, it's because the protocol is not right for them. It's not that it's not going to do something positive at some point, but we need to target specific cellular system to get the people back to their optimal potential as quick as possible. The things I used to say at the clinic, I like my clients, sorry about using that word, but I'm very happy to see my client when they come to the clinic, but I'm also happy to see them leaving the clinic, because that means they are okay.
Yeah. So you've mentioned cancer on the podcast and the treatment of tumours and all that sort of thing. Some people may have seen the content you've done with Justin and Nali Augustine, because Justin's got quite a big following, especially through like Instagram and some certain social medias. That was in a case of cancer. So do you treat a lot of people with cancer? Is that quite a main modality that you look through alongside the PTSD, or?
No, it's not like it's not only PTSD now. It's actually PTSD is probably 10%. It's more about anxiety. It's more about depression, because anxiety is 1 out of 2 students at the University of Montreal. So it's it's getting out there it's getting up very quickly. Mm-hmm. Cancer is also getting up very quickly, and people are looking for support. For side effects, even like I saw a research at some point saying that if you're using regular oncology, because you need to use regular oncology in the medical system, but it can enhance the success rate of oncology protocols, and you can actually see the research out there proving that fact, and it can go up 80% more. So that's significant. So it's very important I think it's a very good tool to add in your wellness day, well-being.
Yeah. And we're trying to move away from the word alternative a lot with PEMF. And I think a lot of brands are now, because the better word that goes with it is complementary. So
complementary.
It's a complementary therapy that goes alongside modern medicine, and with PEMF therapy, there's no risks involved. So what is there to lose?
Yeah, that's why I'm using the word collaboration a lot with the MDs I'm working with. We are collaborating together, because it's not harmful. There's no negative side effect possible. Actually, it's helping in different ways. If you use regular medication, it just only can help absorption of the medication. So it's a very good support in that sense.
And you mentioned about possible tumors shrinking and all that sort of thing. What do we think the PEMF is doing in the body to assist that process?
It's very complex. It's still in a research process. Some of them I've read, they're talking about the calcium 2+ getting a higher level that brings the opposite effect on tumor cells. Oxygenation is one part of it too. NASA has proven that oxygenation can go up 200% while using PEMF, and tumor cells don't like oxygenation.
Yeah.
And it's part of what it's helping regular cells to grow and to become stronger. It's getting tumor cells, it's the opposite. It's getting them weaker. And they don't totally, and we don't today, the researcher don't understand completely the process of why it's doing this, but it is. And it's not like one out of 10 thing, it's a 10 out of 10 thing. So that's why the research, even Cancer International showed a paper saying that PEMF should be part of the tools using in oncology. So that's a big statement from Cancer Institute.
Amazing.
But actually, we don't see it. It's we're not now. We're not there.
Yeah, of course. So, just kind of closing this one off, is there any other clients or success stories outside of the PTSD that kind of stick in your mind that you wanted to mention on this, and kind of had a really good success story with something?
Yeah, multiple sclerosis. I had like a client a few years ago. She came in like she had a suicidal idea. She wants to kill herself, getting over a bridge. And that bridge appeared to have been built by my great-great-grandfather in Quebec. So I told her, do you know why my great-great-grandfather built that bridge? No, it's not to jump it, it's to walk across it. So walk across it and come to see me at the clinic. And she came to the clinic having pain she was 84 at that time, and she was telling me she was suffering from pain since the age of 13.
Wow.
And she was at some point, it was difficult for her to walk because she was diagnosed with multiple sclerosis. And after a couple of months, she was able to walk by herself and going back to do her regular stuff without suffering, without any pain. And she was so happy about that. She started doing Christmas party for everybody except me. So I was teasing her, "Oh, you did party for everybody, not me." and then she came back to the clinic bringing me tons of party. I had for years to Christmas party with me,
Amazing.
That's a very nice story. But I got so many nice stories. Nelly was one of them. I got thousands of them. I'm seeing like lots of people who were coming and they've been told, you're going to be in a wheelchair for the rest of your life, and they're not. And some of them, they'll all get ready to pass and get your paper done, and they are still with us today. And there's a lot of very touching story, and client becomes like part of the family of our clinic family. So we can see them like still around. So it's like a destiny change. It's a game changer for them.
No, okay. Where can people find you, Professor Toy? So if someone actually, maybe they're local to you in Canada and they want to actually come and see you, or how can they find you online?
Oh, we have people from all over the world. Last summer, I had two person from Australia coming to Montreal to the clinic. They can contact me via our website, clinic, which is clinicneurovisante.com. They can find a phone number over there. We have a clinic in Ottawa, Montreal. We have two of them, and they can reach me, or they can go on my LinkedIn, Professor Joseph J. Toy. So
No, thank you again. So thanks for your time today. And for joining us from Canada. So I know it's an early start for you, and it's a later part of the day for us. But thanks again, and thanks for listening to another episode of the PEMF podcast. Make sure if you haven't already, leave us a 5-star review or whatever platform you're listening, and make sure you follow us so we can keep getting amazing guests like Professor Toy. But we'll see you in the next episode. Thanks again.
Thanks for having me. Okay, have a good one.